Question number 9, Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Is he confident that the government's initiative to provide better, sooner, more convenient health care is meeting his expectations? If not, why not?
Honourable Tony Ryle.
Mr Speaker, the government has high expectations for plans for better health services for patients, and in many services I'm confident that we are meeting those high expectations. In some other areas we need to do better. I say this because despite tight times, we've put an extra $2 billion into the public health service, with the OECD reporting in its latest report that New Zealand had the third highest increase in health spending of developed nations.
Supplementary question, Honourable Annette King.
Is 86-year-old Mrs Margaret Mulring of Hastings receiving better, sooner, more convenient health care after recently being discharged from the hospital following heart failure and pneumonia, who cannot walk across the room without becoming breathless, and now has been told her home help will be slashed to 1 hour a week and that her showering is threatened to be cut to just 3 days a week?
What do you say to that?
Honourable Tony Ryle.
Mr Speaker, what I would be able to say to that member, if we please provide the circumstances and the reference to that information, and I will check it out. But I can certainly tell that member we've put significant new money into the Hawke's Bay District Health Board. It looks to me to be over $60 million extra under this government. What I can also say to that lady is she's very good service generally provided at Hawke's Bay District Health Board, and we don't cull patients off waiting lists like we did when that member was in government.
Supplementary question.
Supplementary, Mr Speaker.
Order. Supplementary question. Honourable Annette King.
Has he been told that because Mrs Margaret Mulring's home help carer was unable to complete all her housework in the 1 hour allocated, that Mrs Mulring went out and brought in her own washing, fell over twice, and is fortunate that she wasn't seriously injured? And does he think that, with all the money he has put in and all his bluster, that is better, sooner, more convenient health care in the Hawke's Bay?
That word here from last week, didn't it? Mr Speaker, what I'm aware is there have been some changes. There have been some changes to home care services in Hawke's Bay. My understanding is that this is so that services can be better targeted at other people who are being discharged from hospital, that they do hope that they can help more people with that money. But I say to the member, please bring that case to my attention. I will make inquiries on behalf of her. What I can say is we are putting substantial more money into the Hawke's Bay District Health Board. We are providing more services, and we do have an elected District Health Board in the Hawke's Bay, which was quite different to when that government was in office.
Supplementary question, the Honourable Annette King.
Well, in light of that answer, did he read Mrs Mulring's letter sent to him and to the Prime Minister about her plight before he passed it on to Joe Goodhue, none of you who have answered her letter? And is that the way the government complain? They don't get any complaints in health. Nothing to see here.
Honourable Tony Ryle.
I'm absolutely sure of that letter. I'd have to verify those facts from the member, but I'm absolutely sure that if they have been passed on to Mrs Goodhue, they will be looked into. What I can tell that member is that more money is going to Hawke's Bay. They want to help more people, but actually, if that member brings that facts to my attention, we'll endeavour to deal with the case.
Supplementary question, the Honourable Annette King.
Thank you, Mr Speaker. Did he tell the people of Hawke's Bay, when he signed off their annual plan, that the level of service provided and the standard of some services, quote, may have to be modified, and that meant it could be reductions in the amount of care the elderly would get in Hawke's Bay?
Honourable Tony Ryle.
Mr Speaker, I don't think there'll be any reduction in the level of service that the elderly will get in Hawke's Bay. I think you'll find that spending for services for the elderly is increasing in the Hawke's Bay, not the least of which is in the amount of elective surgery for the people of Hawke's Bay, which mainly benefits the ageing population. A very significant increase, far more when that member was culling 30,000 people off waiting lists.
Supplementary question, Dr. Paul Hutchinson.
Thank you, Mr. Speaker. To the Minister of Health.
Order. Dr. Paul Hutchinson has a right to have his question heard.
Thank you, Mr. Speaker. What reports has he received in relation to expectations of the New Zealand Public Health Service?
Honourable Tony Ryle.
Mr. Speaker, as it happens, I have received a copy of a very important, prominent report that clearly lays out the expectations of the New Zealand Public Health Service. These expectations were shockingly low. In fact, these expectations were depressing, explicitly saying New Zealand's health system, quote, is not rich enough to have the kind of health service found in Australia, Canada, Britain or the United States. The report further declares that, quote, there is a growing understanding, I believe, that in the wider community that no government can meet all New Zealanders' expectations about health. Look, that was a comment made by a new health minister last century, the Honourable Annette King.
Question number 10, Andrew Williams. Order. I've called Andrew Williams.